Should face masks be compulsory in primary schools? Some UK boroughs have advised primary schools to consider face coverings as part of their measures to tackle coronavirus. Lots of responses coming in on this one. Franz says, absolutely no way, Mark. A primary school is where children get their first impression of society. Training young children to believe that walking around all day long in a mask is normal is essentially a form of abuse and a betrayal of duty and care. Let's get the expert view now of Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of...
Good afternoon. Thank you, Mark.
So, Bharat, I have my mask. I always debate the masks on this show, but I follow the rules and it's perfectly acceptable that I wear one because I'm not exempt. But what's your view about primary school children having their faces covered all day long?
We've got to consider all options, and this is the important bit, because if you take a rigid line of I'm not going there, then what you're doing is removing one control armamentum that you may have. And I can see parents' concerns, I can see the cultural issues, etc. On the other hand, if you look at how well the Far Eastern nations have managed to keep SARS-CoV-2 under control and easily managed it, we could learn a lot from them. And I appreciate that with younger people, teaching them to wear a mask in a culture where even the parents and none of us are used to wearing a mask is a tall order.
Well, indeed, Bharat, but here's the thing. Where is the data to support the idea that masking 7-year-olds will stop coronavirus?
Yeah, I take your line. And what I'm about to say was we have to consider all options. And when we consider all options, we consider all of those options with the evidence. We don't push the evidence under the carpet and say it doesn't exist or it isn't there. Therefore, what would I do? What would I advise is look at the data, find the data, create the data by looking at where the infections start, who transmits it to whom, in which order, and therefore you have a reason behind your actions. So we have for some time not wanted to grasp a painful nettle, which is that infections do occur in schools, and we need to look at how much infections occur in school. Is it a big thing? Could it be mitigated by, for example, the balancing act of, okay, no masks, but on the other hand, you need to have increased ventilation and increased spacing out of desks and a better airflow and a better screening of people who come into the classrooms at the beginning of the day in case they're bringing up a hidden, unknown infection.
Sure.
So all of those measures also come into play.
Indeed, but of course we know that children face a negligible threat from COVID. And it seems that even suggesting that small children should wear a mask all day is just disproportionate. And here's the problem, Bharat. You're a very, very nice man as well as a colossal scientific expert. And just the principle of small children wearing masks, even with the data, I still don't think it's necessarily the right thing to do, because the impact, the potential damage on their physical and mental health is something that's an unknown. It's incalculable.
I am with you, Mark, and this is why I am repeatedly saying we need to consider all options, because when you take a option out, you're basically saying, even if the evidence is overwhelming, I'm not going to go there. We mustn't do that. Now, this is a very important issue. So with respect to the younger groups, we know what we know, then there is what we don't know. So we know that most of them do not end up with severe illness, requiring hospitalization, ICU care, etc. But a small number do. One unknown, and we need to be really careful of going forward, is long COVID. Do young people, although they get better, do they go on to have, in a worrying number, long COVID? So all of these things, as I say, as a scientist,
where are the primary school kids with long COVID, Bharat?
No. Listen, what I'm saying, I'm not saying they are there. I am saying keep your options open and look for it, right? And make sure that there isn't a problem with for example, long COVID. I'm not saying there is. I'm saying we need to have our watchfulness of making sure there isn't.
I'm fully with you on following all the rules, and that's always been my message. We debate everything on Talk Radio, but we follow the rules too. And I think it's a no-brainer to have hand hygiene, ventilation, even distancing as well, of course. I wonder whether masks have had something of a free pass in this pandemic, Bharat, given the fact that, the data around them is, scientifically debatable. Countries that have had no mask mandates at all, such as Sweden, have a lower death rate than countries that did. And even countries with a mask mandate exclusive to public transport like Norway and Switzerland, once again are below countries like Italy and France that made people cover up.
Yes, but on the other hand, look at how well the Far Eastern countries have done in crowded places. And as we move on 9 months, 10 months into the pandemic plus, right, we realize suddenly that there is a big element of aerosol spread. And with respect to aerosol spread, we can only do what we can do, which is ventilation, less crowding, less getting close to people, and wear your mask properly. Now, there we are on very firm, strong grounds. So I have to say, in crowded places, you will protect yourself because of a underused principle or under-known principle, which is there's a big element of aerosol spread. But we've got to wear our masks in those circumstances.
Where is the aerosol spread in Sweden or Switzerland? Why have those countries not mandated face coverings and had a lower death toll? What's going on? Do they just have better immune systems? I mean, people say to me, oh, stop mentioning Sweden because Sweden doesn't have a dense population. Well, that's not true. Its cities, such as Stockholm, are very densely populated. In fact, population density in Scotland is far lower than that of Sweden, and their death toll significantly higher.
I know you love it, don't you? And let me answer it for you. So if you look at the excess mortalities in Sweden, it has shot up. So it isn't that Sweden has got away scot-free. The other thing is, just because a country decides to do what it wants to do doesn't mean we have to follow them or not follow them. We follow what we know. And therefore, with respect to answering for the United Kingdom, we know what we know. And I say it with all sincerity, we have an aerosol element in our indoor spaces, and we will ignore it at our peril. So that's my opinion, and the opinion of many of my senior colleagues, that there is a big element of aerosol spread in indoor spaces, especially.
How long do you think we will have these face coverings for, Bharat? Just a few months or forever?
Good question. So we need to have lowering of our case numbers in our community. That will give us a very good measure of the virus isn't around, therefore you can let go of your infection control measures. On the other hand, people may now adopt a different style, which is as soon as I have sniffles, coughs, colds, something like that, I'm going to wear a mask. And that would be a cultural change. And look at the evidence. So we've had a high uptake of seasonal influenza, plus the wearing of masks, plus infection controls that we did. And as a result, we've had a record low influenza cases in 2019, 2020, 2021. So it has a positive effect, these infection control measures, and people may continue to wear a mask. New cultural change.
But look at you, Bharat. You have survived many years when subjected to the seasonal flu, and your immune system has helped you out. Now wearing masks is going to be necessary to stop a virus in the seasonal flu that previously we accepted was out there.
Yeah, it's good. There's progress.
Is it progress covering our faces? And also, Bharat, are you an environmentalist?
I know
are you a supporter of the environment? Because I spoke to Keep Britain Tidy, who said that we're throwing away 53 million disposable masks every day. There's a report in The Guardian that said the cloth masks keep the COVID virus embedded into the cloth for 3 days if you don't wash them. How many people regularly change their face coverings? The environmental impact, honestly, I think that at best, Bharat, these face masks should be worn whilst they're mandated. But when the mandate's over, we move on and we don't wear them again.
Well, people should be allowed to make their choices. If they want to wear a mask, they should wear a mask whenever they wish to. I was going to say something, which is, look, we have for many, many, many years put up with deaths following influenza infections. And the wake-up call to all of us is, why did we put up with it? We shouldn't take it as the norm that people die from influenza. We should say, we want fewer deaths from influenza. We want people to be immunized. We want infection control. We want you to wear your mask if you're infectious, and all those measures. Why do we just accept it? We shouldn't accept it.
Well, Bharat, because of the trade-off between possibly, and this is debatable, the prevention of something like flu because of face masks, and the environmental impact, and also the cost to society, human interaction. I've spoken to top professors who have said that it's having a big impact on the way people interact with each other, plus the fact that there is a possible health downside to covering your airwaves for prolonged periods of time. I'm not saying that is the case, but it's a possibility, isn't it? Why would you take that chance?
No, of course not, Mark. That's stretching it. That's really pushing it now.
You've got to stretch the mask to breathe, Bharat.
That affects your oxygen intake and your CO2 expulsion. No, not at all. But I hear you.
Have you been on the treadmill wearing a face covering, Bharat? I mean, if I did it, I think I'd have a coronary heart attack.
But I'm not talking about wearing your face mask on your treadmill.
Well,
honestly,
some people think we should wear them whilst jogging, and that's where it's going now, Bharat. Primary school kids, joggers, what's next? The unborn, get them masked up.
No, Mark. Look, let us end on a better note, which is this. Don't take things off the table. Think about it, and then have your measured actions, which is what we've always been about. It's not about, just let's follow some bandwagon. But what we do is we look at the evidence and keep everything on the table rather than saying, this is sacred, we're not going to address these things.
We have disagreed on this. At the same time, we're so deeply grateful for your expertise and your knowledge, which is far more infinite than mine. You've got more knowledge in your fingernail than I do in my whole body, Bharat.
Oh, no, not really, Mark.
So, in the end, it is all about opinions. However, you did say that at a certain point, it should be personal choice. And for that reason, you get the fanfare of free speech. Here we go, Sam.
Thank you.
Let's fire it up. Here we go. It's well worth the wait, Bharat. All views are welcome, and Bharat, yours is an expert one. Thanks so much for your time and your good humour. Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical Centre, who suggests not necessarily for or against wearing a face covering in a primary school setting, but he says keep every option on the table. What's your view? You've heard from him. You've heard from me. You know my views.